When was your last cervical cancer screening? The rules just changed. Let's dive into this explainer. So, the American College of Obstetricians and Gynecologists, or ACOG, just dropped their updated guidelines for 2026. Basically, your screening schedule depends entirely on your age. Let's break down exactly what you need. If you're between 21 and 29, ACOG recommends a routine cytology screening every 3 years. Simple enough. Quick refresher here, cytology looks for abnormal cells, while HPV testing looks directly for the actual virus. Now, for the 30 to 65 crowd, the preferred method is a clinician-collected HPV test every 5 years. If that's not available, totally fine alternatives include co-testing every 5 years or just cytology every 3 years. Older than 65? Well, routine screening actually stops if you have an adequate prior screening history. And by adequate, they mean 3 negative cytology results in a row or 2 negative co-tests within 10 years. Also, screening stops completely if you've had a hysterectomy that removed your cervix and have no cancer history. So, the key is getting tested. But what if getting to a clinic is super tough? Can you self-test? You can. It totally expands access, but honestly, it carries huge risks of misdiagnoses if follow-up fails. ACOG stresses self-sampling should only happen if you prefer it, and the clinic has rock-solid follow-up systems ready. This brings us to health equity. Tragically, underserved communities face the highest mortality rates simply because of lower access. ACOG's conclusion here is pretty stark. A complete lack of screening is literally the biggest danger to patients. So the big goal is simple. Maximize access to screening for everyone without worsening those existing healthcare disparities. The guidelines give us a clear roadmap, but the real question is, how do we guarantee everyone gets access?